we've asked everybody to do given the outbreak of the cluster. Can I also thank our contact tracers and those doing the genomic testing in health who've literally been working 24/7 to get on top of this outbreak as much as possible. Yesterday we'd advised that as at 8 p.m. last night, there'd been 15 locally acquired cases linked to the Avalon cluster. 2 from the previous day had brought that total to 17. There is also one additional case of a person who travelled to Queensland that also had obtained that from that same cluster, which brings that up to 18. And then overnight, since 8 p.m, we have had 10 additional cases. So those 10 additional cases mean that in the last 48 hours, there's been a total of 28 linked to that cluster. All but one is confirmed to be linked to that cluster, and Dr. Chant will provide a detailed breakdown of what those 28 cases are and what that means moving forward. Can I please stress to everybody in and around Avalon and the Northern Beaches that for the next 3 days you should not be leaving your home unless it's absolutely necessary. Please make sure that if you do leave your home for necessary business that you wear a mask, especially if you're going grocery shopping, especially if you're catching public transport. And of course, stay away from non-essential activities such as entering what we regard as those high-risk venues, whether it's a hotel, a restaurant, a cafe. People should only be undertaking on the Northern Beaches absolutely necessary activity. And if we get on top of this in the next 2 or 3 days, all of us will be able to have a much better Christmas. But if we don't get on top of it in the next few days, it could mean further restrictions down the track. We don't want to go for that. We want to see what we can manage with the existing guidelines we've set for the community. And I do want to thank deeply the community of Avalon and the more broadly the Northern Beaches who have responded very positively to what we've asked them to do. Minister Hazzard will outline all the clinics that are available for testing. We do note that some people said yesterday they had to wait a couple of hours before they were tested. We want to avoid that. So there's at least a dozen places you can go get tested, including over the weekend, which Minister Hazzard will outline. 6 or 7 of those were popped up or stood up yesterday to give that extra ability for people to get tested as soon as they need to. Can I also express a broader message of high alert for everybody around Sydney? We know, and Dr. Chant will communicate, that a couple of the cases, although they're directly linked to the Avalon RSL or the Avalon Bolo, a couple of people at those venues weren't from the Northern Beaches. They've gone back to their home, get back to their other suburbs, and Dr. Chant will elaborate on that. But it does mean there's potential seeding outside of Avalon and outside of the Northern Beaches, and this is what we need to prevent. So everybody in Greater Sydney needs to be on high alert. If you have the mildest of symptoms, please get tested and isolate. But also, can everybody please think about their activity? Nobody should be getting on public transport without wearing a mask. Nobody in Greater Sydney should be going to a supermarket, a place of worship, or other high-risk areas without wearing a mask. It will just be crazy if people are undertaking those activities without wearing a mask, because the harder all of us work together, the better Christmas we will have, and that's certainly our objective. But even people in Greater Sydney should think about what they're doing. I know that there are a lot of Christmas parties on at this time, a lot of social gatherings. Please consider what is essential, and if you are going to continue those activities outside of the Northern Beaches, because certainly we don't want anybody on the Northern Beaches doing that, but if you are going to continue those activities, please be extra COVID safe. I also want to call out to businesses and organisations. The feedback from health is that some venues have been outstanding in their QR codes and keeping records of who's been at those venues. Some others have been absolutely hopeless. So we need to make sure that everybody works extra hard. Nobody should be entering any venue in Greater Sydney where there isn't strict adherence to QR codes, where there isn't good record keeping, because that means you and your family are at risk. The last thing any one of us want to do is get the virus and turn up to Christmas lunch and give it to all of our loved ones. And that is a potential risk at the moment, given the number of cases we have. And we always, in New South Wales, pride ourselves on having a proportionate response to what's occurring, but I don't want to understate how serious the current outbreak is and how hard all of us need to work together to get on top of it. And that's my strongest message today. We do have the potential to get on top of it. However, it requires hard work from all of us. I was asked earlier this morning about my response to what other state leaders are doing in relation to the borders, and I'd ask everybody just to have a proportionate response to what's happening in New South Wales. If I was a leader in another state, I would certainly be making provisions about people who are coming from a hotspot, from the Avalon cluster and the Northern Beaches, but I ask people to consider the fact that vast parts of New South Wales are completely unaffected, and we want to reduce the stress as much as we can on our citizens. Many people, after months of absolute torture, for want of a better term, have been separated from loved ones, as have employers in terms of their ability to keep employees on their books. And we just ask everybody to consider that and to have a response which is measured compared to what's going on in New South Wales. But again, I want to thank the community for responding. I also want to make sure that people outside of Avalon and the Northern Beaches also are on high alert. Think about what you're doing, where you're going. Better to be cautious than not. If you're going grocery shopping, wear a mask. Jumping on public transport, wear a mask. In particular, if you're going to a place of worship, please wear a mask. We know where the high-risk activities are. We know what the high-risk events are, and we need people to respond accordingly. So just to recap, as at 8 p.m. last night, we had 15 community transmission cases yesterday, 3 other cases which brought the total to 18 from that Avalon cluster, and an additional 10 since 8 p.m. last night. But I also want to stress to the community and to everybody that as soon as health gets information about a venue or about someone who's acquired this disease who may have exposed others, you will get information in real time. You will get it at the same time I do. However, as far as the numbers are concerned, to avoid confusion, we will be providing one daily update at 11 a.m. on the numbers to make sure that everybody is clear on what's going on. So can I stress, everybody gets real-time information on venues, on close contacts, and you would have seen overnight about 15 additional venues were put on that list. Many of the people involved have been very social, but they've been largely contained to Northern Beaches. However, there are some venues and a couple of individuals that were outside that area, and again, Dr. Chant will provide that update. But please be assured you will get information as soon as I do, because that's what's allowed us to respond quickly. But just for consistency's sake, around the numbers, we'll provide a daily update at 11 a.m. until the foreseeable future. I'll now ask Dr. Chant to give her update. Then Minister Hazzard will provide further detail on where people in particular can go and get tested, and also other health advice. Thank you.
Thank you, Premier. So perhaps if I just break down the two situations we were dealing with. So earlier in the week, we reported a bus driver who transports international flight crew. We've had no further cases associated with that bus driver, and certainly to date his close contacts have tested negative, but obviously they're in isolation and we need to wait that full 14 days, but they don't pose a risk to others at this time. In relation to the genome sequencing has demonstrated that that strain that gentleman had was most likely a US strain, and that is consistent with the hypothesis we have that inadvertent transmission by a flight crew that he was transporting was the source of his infection. So we remain vigilant in relation to those cases, but at this stage we have not had any further cases associated with that gentleman, and his exposure in the community was very limited. We have had one other venue that we've identified, and again, we appreciate the cooperation of the community. In relation to the Avalon cluster, I can, as the Premier indicated, there are 28 cases associated with that, and that's including the one case that was diagnosed in Queensland. So in terms of the breakdown of where people attended, 8 people attended the Avalon RSL on the 11th of December. 16 attended the Avalon Bolo on the 13th of December. 2 cases attended both venues, and 2 cases have been linked to one or either of these venues. So that clearly shows that we've had a significant seeding event that's occurred, that we think occurred on the 11th of December, and then people were infected at that time and then attended the Avalon Bolo and then amplified the infection further there. So it is, so anyone who attended the Avalon RSL on the 11th of December in the said times and the Avalon Bowler on the 13th of December, you should have been contacted by New South Wales Health Contact Tracing, and we acknowledge and appreciate the efforts of the businesses to assist us in that contact tracing. But it is essential that you get tested and you adhere to the health advice around being isolated. In terms of the genome sequencing, in relation to that case, again, it showed an international strain of the US, likely US origins. And we are at the moment looking for where that potentially could have matched. We have found a case in a returned traveller where there are some similarities, but at this moment our investigations are very preliminary and we are looking at any source. But all I can say at this stage is it is of American origin, US origin, and it is similar to a strain that we have seen coming in terms of an overseas return traveller that did come in here around early December.
Kerry, just talk about the ones outside the
Okay. So there are a number of venues. People did travel to the Northern Beaches to attend the Avalon RSL in particular. So we have got people that are residing in other suburbs outside the Northern Beaches in Cronulla. There's a list of the venues that we're particularly concerned about. So in Penrith, and there's a whole list of casual venues, casual contact venues that have been listed, and also some train and rail trips. So I would urge everyone to go to the New South Wales website. It is broken down into those that are close contact venues where we require people to get tested, then to isolate for the 14 days, and for the advice around some of the casual contacts where it is to get a test and then remain isolated till you have a negative result and then monitor for symptoms.
Thanks, Kerry. So I want to start off by just saying that over the last few weeks, the Premier and I and Dr. Chant have all been talking to our community about the amazing work they've done, but we've also been talking about the creeping complacency that has occurred. Well, I think we'd have to say that from being out and about the last 2 weeks, the complacency is no longer creeping, it's an avalanche. We need to actually have all of the community aware again that we are in the middle of a worldwide COVID pandemic. And I think it's time for us, with the Avalon cluster has served as a very timely reminder to all of us, particularly those in the broader regions of Sydney. There is no room for complacency. Until we have a vaccine, we don't have a solution. We have to keep our borders open to returning Australian travellers. We have to keep the air crews coming in because they're bringing in vital freight for our residents. So what we do need is everybody to be aware that you can only do so much. There will always be the possibility of something creeping out from somewhere. We can keep plugging the holes, but we just need everybody to be aware. Complacency just cannot continue. So, and on the Northern Beaches, particularly around Avalon, which is of course the peninsula that I've grown up on and live on, I've got to say that that complacency has been there as well. And this event around the Avalon cluster again is a very important, I think, reminder for all of us that we need to take care. Again, I want to thank the resident staff of the Northern Beaches and particularly the northern end of the Northern Beaches, because you've come out in massive numbers today. As a result, we've doubled the number of opportunities for people to have tests. And I'm just going to run through that list so people know where they are. If you missed this, then it's on it will be on the health website. First of all, the Avalon pop-up, that's at the Avalon Recreation Centre at Old Barrenjoey Road. Avalon Lavity drive-through pathology, which will be in the Avalon Bowling Club car park. That'll operate from 8 a.m. to 4 p.m. The others are mostly open from 8 a.m. to 10 p.m. Palm Beach Lavity drive-through pathology, and that's also opening today. That is in Governor Phillip Park car park. The Newport pop-up, there'll be one at the Newport Community Centre, a pop-up there. There'll be Warringah Aquatic Centre drive-through. I actually saw that one this morning and the traffic was very long, which is a good sign for people, but it also means that you should think about going to other venues as well. Mona Vale Hospital walk-in clinic, obviously Mona Vale. Brookvale Community Health Centre, and that's a very good one. I was there a couple of weeks ago having a test. It's certainly if you need to go somewhere. That's down opposite Ringham Mall. Northern Beaches Hospital. Manly Histopath drive-through at the old Manly Hospital site. That's 150 Darley Road. North Narrabeen Clinical Labs Pathology drive-through clinic. That's at Pittwater Road, Narrabeen, 1416 at Narrabeen. And Warriewood Histopath drive-through at Rat Park, which is 1472 Pittwater Road at Warriewood. The final one is a little bit off the beaches, but if you're up that way, it's St Ives Douglas Hanley Moir drive-through pathology, which is at St Ives Showground, which is just on the edge of the Northern Beaches area at 450 Mona Vale Road. So again, as Health Minister, my important message is this is a salutary reminder that we're in the middle of a 1 in 100 year pandemic. Don't let complacency creep in, because you may be the person who suffers, but it may also be your family, your mum, your dad, your uncle, particularly young people. I'd say this, young people think that they're immortal. Well, no, you're not, but most importantly, you need to know that by not getting tested, if you've got any symptoms of a cold or flu-like illness, you're putting your older relatives, your grandparents, your aunts, your uncles, your mum and dad at risk. So everybody, this is a journey for everybody. Be on it and get tested. Thank you.
So the Queensland case, when we first tested positive in Queensland, came from Sydney, came from the Northern Beaches, went to Queensland and was tested positive.
Yes, so that individual was identified through our contact tracing efforts in New South Wales. We contacted that individual, and that individual had already departed and was in Queensland at the time. We advised them to isolate and get a test. They then contacted the Queensland officials prior to the test result coming back and were advised about safe transport back to New South Wales. So they drove their own car and made their way back here, and during that journey they received the positive test result.
So they drove up there and they drove back?
They actually were associated with a flight, so Queensland will be doing contact tracing associated with the flight up, because they had already left before they realised we had not advised of the fact that they'd been designated at the RSL at that time. So we reached them through the contact tracing, and again that is appreciation to the Avalon RSL, who was able to provide digital records to us very timely, which really facilitated us getting the message to the residents.
Did they fly to the Gold Coast or to Brisbane, Dr. Chan?
Look, I can find out exactly where they flew, but they flew on a plane, and the usual process will be that the Queensland health officials will do the contact tracing around the plane. We're obviously following up with the person here to find out if they had other exposures whilst infectious, and again we will update any venues frequently. I would like to say to the community that the venue list is getting updated very frequently, so please do make that a regular part of your day to go onto the New South Wales website at least a couple of times, if not more a day, just to check those venues. And that's part of the reason why we really want residents in Northern Beaches to adhere to the health advice about basically staying home if at all possible, keeping to yourself, because you may well have been to one of these venues and inadvertently be a close contact, and we don't want you out and about at this time.
Do you believe that the systems that we have in place for aircrew is sufficient at the moment, or do we need to go a step further?
So I think the Minister may want to answer that question in terms of the next steps.
Can I just say that we have been working on that. The week before last we had a meeting with New South Wales Health and myself and representatives of the major airlines that fly into Sydney. As late as yesterday we had another meeting with those aircrews, and we listened to their issues, but we've also made it clear that we want to move forward with some tightening up of the arrangements for those crew. Obviously the airlines would like their crew to have certain entitlements, but at the end of the day we're keen to make sure that our community is the paramount concern, and that is safety. We obviously want the air crews to continue to fly into New South Wales, and I can say that I've been having discussions also with the Victorian Health Minister and the Queensland Health Minister and also the Federal Minister. So we'll be making some announcements on that in due course.
Could you be more specific about what tightening up would be?
Would the Premier like to announce that now?
I think I would.
Oh, okay, well, okay.
At this stage, the usual protocol is that aircrew go to their designated hotel, depending on where the airline takes them. And there are 25 or 26 different hotels where the aircrew are located, which makes it very difficult to police. From Tuesday, I can confirm, given the good work the Minister for Health has done with his colleagues, as have the New South Wales Police, that from Tuesday there'll be 2 designated hotels for all aircrew. It does put pressure on those airlines and those aircrew, but we have to consider the right balance. So from Tuesday they'll all be designated in 2 police hotel quarantines as opposed to 25 or 26, which will mean that there will be better compliance. So can I also stress the issue isn't the guidelines we have in place. It's unfortunately a few occasions when people breach the guidelines or actually chose not to self-isolate when they should have. I want to make that very clear. The systems themselves haven't been the challenge, but it's been people disobeying what's in place. From Tuesday, there'll be no chance of disobedience given the police and health will be ensuring that they are located at 2 places close to the airport as opposed to a wide range or right
Is
number.
that the just to clarify that with this
No. Can I make it clear, and Dr. Chant made it clear, we do not yet know the exact, we know it's an international strain, potentially strong links to the US, but we don't know exactly what overseas traveller was the person that's the cause of that, and Dr. Chant's made that clear. But we have had previous cases which have been related, the transport worker, for example. Yes. So can I just stress, that it's not the systems we have in place at the moment, but unfortunately the lack of compliance. But from Tuesday, that door will also be shut because police will be able to literally police those 2 hotel quarantines. Well, yes, although they have different. Yes, they have different rules because they're in transit. They don't have to stay. They're actually able to be in isolation until they have to get on the next flight back to their job. So obviously, if you mandated 14-day quarantine, you wouldn't be accepting any flights, and Aussies wouldn't be able to come home, and that's the balance we have to wear. But I think that's a good reminder to all Australians about the burden New South Wales is wearing. We've said all along that it's a huge risk for us, but it's a risk we take because we want Australians to come back home, and we also, as the Minister said, want freight to come back. But I want to commend the Minister for Health for the work he's done, our health officials, but also the New South Wales Police, who'll be able to stand up the new arrangements from Tuesday.
Premier, just to clarify, what does it currently look like, just to the public who don't understand where these aircrew are going at the moment? They're coming in from a flight from the United States. What happens? There's 25 hotels. Are those police? Do they have police there? Is it the airlines who police it?
Yeah, at the moment, that's obviously up to the airlines and the aircrew themselves to maintain their self-isolation. And in order to close that door, we are saying to them from Tuesday, our New South Wales Police will actually be enforcing compliance. We've given the next few days to adjust and get everybody used to it. It's a massive operation, and as the Minister for Health knows, every airline has had different policies. But now to close that door, from Tuesday, they'll all be required to go to one of 2 hotels, which the police will be able to monitor to make sure that everybody is actually respecting the guidelines. And I want to stress, it's the breach of the guidelines that's the problem. It's not the actual guidelines themselves. It's people, unfortunately, doing the wrong thing. And we can't risk that because we know also that in addition to the number of people that are coming back home, the infection rates in Europe, in North America, are actually going through the roof. And as you noticed, before the outbreak we had in Avalon, the number of cases overnight from quarantine was going up because of the nature in which the infection's increasing overseas, and that obviously has an impact on the aircrew as well.
Premier, at the moment you've got health advice for people on the northern beaches to stay home where it's not crucial travel. Will you consider enforceable mandatory rules requiring people in just that part of Sydney to do that?
Well, look, we're hopeful it won't come to that because to date the community's demonstrated enormous goodwill. They've responded to the additional testing we've asked them to do. We know from anecdotal evidence this morning that people are staying home, they're not coming to work, they're restricting their behaviour. So I want to thank the community for taking that response. New South Wales has always adopted the approach that in the first instance we are grateful for the goodwill the community demonstrates. If we find we're not getting on top of the virus, we will need to consider further measures. I'm hoping it won't get to that.
What sort of measures would you consider?
Well, obviously what you suggested, we don't want to go down the mandatory path, but we will if we have to. But at this stage, let's see how the next 24, 48 hours goes. I won't hesitate to take on health advice if Dr. Chun and her team give us advice to the alternative. At this stage, we believe what we have in place is commensurate or matches what the risk is. But I also do want to stress we don't want to be in a position just before Christmas to have to restrict the easing of restrictions we put in place a couple of weeks ago. So we don't want to do that unless we absolutely have to, but I can't rule out that option until we know what the next 24, 48 hours looks like. But I do want to thank the community for responding so favourably. I know from the testing regime overnight, but also from the behaviour of people today, especially in Avalon and the Northern Beaches, that people are taking our advice. They are listening to the health messages. But if we don't feel that's enough, if we feel the number of cases is going up to an extent we're not comfortable with, we will take greater measures in and around the Northern Beaches community, and perhaps even through Greater Sydney if we feel that risk is there. As Dr. Chant highlighted, there are a few people who frequented those venues who had the disease who don't live on the Northern Beaches, so we're making sure their close contacts are in isolation and making sure that everybody around them is on high alert. So it is an evolving situation, but I can't thank enough the contact tracers in health and all the other agencies, whether it's our police, whether it's Service New South Wales, who are getting the message out, because the public is responding. But if we don't feel that response is adequate, we will have to consider other options.
Dr. Chant, you mentioned, I understand it's early days for this case, but you mentioned that sequencing from the Avalon cluster has some similarities with at least one US overseas arrival. Is this a person in quarantine, or is this person crew or exempt?
This is a person who was in hotel quarantine. And as I said, it's similar, but as I said, it doesn't allow us to confirm that that person is the source. Obviously, you'd expect us to investigate all avenues, and we are doing so. So we are reviewing all of the individuals around that case and the movements of that case. But I can confirm that that person was in a police hotel, then became unwell, and then was transferred to the Sydney Health Accommodation Hotel, which is where positive cases go.
Did that person go to any of the venues in Avalon or Palm Beach?
No, the person is in quarantine.
Is there a chance that patient, sorry, Dr. Chant, is there a chance that patient zero who we are looking for might not be in Australia anymore? Could
Yes.
they be an airline
Yes.
that's now gone?
Look, we simply don't know. All we know is that the incredible tracing work, keep in mind this all really only started just over 24 hours ago, to have got where we've got to, just as evidence again of the tracing and tracking teams that we use in New South Wales Health. They're actually better than gold standard, they're diamond standard. And they've managed to track all of those cases, the 28 cases, to those two venues, Avalon RSL and Avalon Bolo. So the next question then was, well, how do we find out what the source was? So they were doing the genomic sequencing, and I think I might have mentioned that to you yesterday. Late last night, I think, I was told this morning, the genomic sequencing showed that it was very close in terms of the genomic sequence that was taken from this particular US traveller that arrived on the 1st of December and entered into, as you'd expect, into our quarantine hotels, our police-managed quarantine hotels. At some stage, a couple of days later, she got ill and she was transferred, as you'd expect, to our, and became positive, to our health hotel. The work is continuing, though, to try and establish what that person's connection may have been. Now, there may be intermediaries. We don't know whether it's one, two. Those are very difficult issues for the tracers to work through. But they're doing what they do, and if we get more information, we'll let you know in due course.
Does she remain in that
Sorry.
hotel, Minister? Does she remain in that hotel?
Yes, yes, she does. Yeah.
Can we ask, what about Australian aircrew?
Yeah.
Anecdotally, a lot of pilots and aircrew live on the Northern Beaches. Is that a possible weak spot in this case?
Well, we've been doing the tracing on that, and the advice that we've had this morning is that they don't believe that any of those aircrew are actually the source, but it's possible. We're still working through those issues. You raise an interesting point, because some of the aircrew that come in are Australians, and of course the international arrangements have been that home country crews can normally go to their homes, and we are looking, and we'll be making some announcements on that probably today.
Is there
Sorry, hang on 2 seconds, sorry. One of the issues that we're looking at is possibly requiring them to be tested before they go to their home, just to make sure that they're at least clear on the day one when they arrive. And then requiring some further reporting in, effectively, or checks while they're at their home. Many of them are only here for, as you would expect, 24 to 48 to 72 hours, and they turn around and head out again. So, but we're putting in place measures that cover the entire ambit of air crews. Everyone's getting a look at the moment. And can I say on this, the difficulty of this is that as the airlines pointed out yesterday, they would like a uniform position because they're flying into different ports across Australia. So it's a challenge for us to deal with this as a state, but we're doing it. But as I said earlier, we have very good relations with the Queensland, I have very good relations with the Queensland Health Minister and the Victorian Health Minister, so we're working through those issues. And I've spoken to the Federal Minister this morning and just mentioned what we're doing, and we'll work through those issues, as you'd expect us to do. Sorry, at the back, hang on, sorry.
I'm just wondering, is there a potential that the super spreader was someone who's been in contact with an international flight crew?
Yes, it's possible.
Is it possible?
But it's also possible it might not be. You know, that's the probability. Can't answer
An
it.
international flight crew member?
It's possible.
Premier?
Hang on, Premier wants to...
Can I just say, and Dr. Chat might want to add to this, but we shouldn't make the assumption there is a super spreader. There was a lot of people at a venue where people acquired the disease. So, no, understand, but the point you're asking is, do we have a direct link between the overseas person and the community person who may have acquired it? We don't yet, and I don't know if Dr. Chant wants to add anything to that, but that is what the genomic tracers are doing. The genomic tracers are so brilliant, they've been able to work out from the people who've acquired it in the community that it is linked to an overseas chain, in fact a US chain. But beyond that, we can't make any confirmation, and we'll let you know as soon as we do.
Premier, you said before that the issue wasn't in fact the guidelines, it was people breaching those guidelines. What sort of breaches are we talking about?
Yeah, look, I can confirm without outing the particular airline. There was one airline crew a few weekends ago that actually breached their isolation and went out to venues. So fortunately, that doesn't seem to have amounted to anything. It was not. They're not subject to any consideration at this stage, but that is an example of a few weekends ago when aircrew who were supposed to be isolating chose not to.
So
and luckily,
can
you let me finish the sentence, please? So clearly there was a breach there, and since that time we've been working with authorities in how we can manage it. We've been working with airlines in relation to how we can manage it. So it is a very complex set of circumstances, and that's why we've been at it for the last 2 weeks, and that's the only reason why. It's because those conversations started a few weeks ago that we're able to stand up a new system from Tuesday, which is very complex, but I want to again thank the Health Minister, the health team, and also the police for being able to start those new arrangements from Tuesday.
Of that crew that went to some venues, were any of those members?
No.
Will they be punished, Premier, the crew or the airline?
Well, it's very difficult when they're not Australians. It's very difficult when they're flying in and out and bringing Australians home, and that's the challenge. We don't have jurisdiction over people in that situation, which is why now we'll make it part of the arrangements that you have to be in a particular hotel if you're aircrew, and that's why the Minister has been balancing these very delicate issues. If they were easy, they would have been solved. They're very delicate issues, and at any given time, there are hundreds of people who are aircrew that are coming in and out any day, several hundred any day. So it's about us shutting the door on every risk factor that we can see, and that's why from Tuesday the system will not only rely on people's goodwill and compliance, but it will literally be policed.
How many crew was it?
Guarded by New South Wales Police from Tuesday. So does that mean if there's a similar breach that we saw a couple of weekends ago, it's within New South Wales jurisdiction? Is it Border Force who?
Oh yeah, no, we've discussed. I don't know if Minister Hazzard wants to add further comment to that.
Clearly, the issue is that we would be managing the crews in our quarantine hotels. So we have quarantine hotels which have been very, very good. So we're just simply stepping up to use that model, but putting the air crews in there. And they'll be there for their 24, 72-hour turnaround. As you were starting to say a minute ago, we actually have many crews, somewhere between 2,000 and 3,000 people a week coming through our system. And of course, we do have international obligations to what the understanding is worldwide about how these air crews would be looked after. But we also, our care as New South Wales is to look after our community. So we're trying to strike that balance. It's difficult. I think the Premier used the right word when she said it's delicate, because we actually don't want them to say we aren't flying into New South Wales. We want them to continue flying. Freight and Aussies coming home are crucial. So we're delicately negotiating, but we have reached this position where we think that we can provide them with the comforts they need, but in a hotel where our police are quarantining the boundaries, and we think that will work best. And I'm working. Sorry, hang on. Sorry, and I'm currently working on those orders with our legal people to put those in place. Sorry.
Still working on, I suppose, obviously to police to enforce these quarantines.
I'm sorry, could you say it again?
It's up to police to keep people.
But we're going to keep exactly the same model.
What are the ramifications in place if people breach those quarantines?
Well, obviously there are penalties that can be imposed, but we also have to delicately handle, this is international politics. We have to make sure that we delicately handle the crews as far as is possible. I'm not saying, and if the crews are listening, I'm not saying that there won't be enforcement, there may well be, but we certainly have to be a bit sensible about the balance we strike, because we want them to continue flying into New South Wales, bringing the freight that we all need and the Aussies home.
I understand.
Sorry, one at a time.
Did you have a COVID test last night?
I did.
I did.
Well, first of all, I'm from the Northern Beaches. Secondly, as I was about to depart for home last night, I realised I had a bit of what I think is hay fever. Turned out it is, but anyway, so I went and had a COVID test and then went home. So.
Minister Hazard, sorry.
And missed going out to a show last night, and I think I've also missed out going to Queensland for my...
Just confirm, you did isolate until...
Oh yeah, of course, went straight home.
So, if there was a breach in this airline...
I should tell you it's a negative result, by the way. Okay, that's all right.
So you're going to Queensland?
If there's...
I was, but I'm not now. I was heading up there on Queensland morning because my wife is a... Christmas morning, sorry, Christmas morning. I'm hoping I get a refund from Virgin if you're listening. I hope I get a refund.
There was a breach. There was a breach.
Sorry.
Are you staying in alternative accommodation or are you moving in and out of the Northern Beaches?
Pardon?
Are you staying in alternative accommodation from now or will you be...
No, obviously I've had the COVID test and I'm at my home. Yeah, good, sorry.
So, just to clarify, this breach...
Can I say also, we have critical workers, and I think at the moment you're probably not quite as important as people at the front line as our doctors and nurses, but certainly at the present time it's pretty crucial that I'm involved in what we're doing. Yeah, sorry.
I understand this is a very delicate situation that we need airlines to keep bringing people home, but if there was a breach a few weeks ago, how long ago is a few weeks ago?
Oh, look, it's only... look,
it's today's Friday, and by Tuesday we'll see those changes. So why
international diplomacy with more than nearly 90 crews, 90 airlines, takes a little while, but we've been working on it and doing that at the same time as we manage everything else.
I want to ask you, sorry, would you be requiring Australian crew who live on the Northern Beaches to come forward for testing just to eliminate that risk source?
I'll let Dr. Chan answer that one.
So, just as part of our investigation, we are looking at anyone who could be a source, and we're casting the net wide. At this moment, can I just say, flight crew self-isolating on the Northern Beaches have not raised concerns from our investigations to date. We're obviously looking at whether there were any other people that were had any other risks factors for acquisition. So we're casting our net far and wide. As I said, the sequencing shows some similarities to a person who was clearly infectious on the plane coming in. Her day 2 swab was positive. She was put into home quarantine, put into police quarantine, tested, and then the appropriate transfer to the Sydney Health accommodation. So obviously we are at the early stages of the investigation. Now, this is genome sequencing. We have very good, solid genome sequencing, but like all scientists, and I've spoken to Dr. Cicinto many times overnight, what we can say is that it is similar to the strain in that traveller. Now, given that traveller returned around the 1st of December, clearly that fit is plausible timeline, but we can't exclude that there is another person that's got a similar virus that has come in from overseas as well. So we've got to keep a very open investigation. In relation to the matter of the flight crew breaches that were alluded to, just want to reassure the community that all of those individuals were tested and were negative, and police was managing. They were referred to police, and police were managing it. So it was.
Can you tell us how many there were, Dr. Chan?
Look, I don't have that number to hand, but the breaches were notified. Police took action, and we ensured that everyone was tested.
Last few questions, please, everybody.
Given the apparent spread in the community in the Northern Beaches, wouldn't it be safer to enforce masks to kind of quash the wave or the cluster, sorry?
So at the moment we're actually saying that you need to do a variety of actions. So it's not just about mask wearing, because we actually are encouraging people not to be out and about. We're actually saying stay at home as much as you can, only mingle with your household group. Please don't go to a number of high-risk settings such as hospitality, places of worship, gyms at this point in time. So really give us some time over this next 3 days please stay at home as much as possible. If you have to go out, please wear a mask. So that is our advice. Can I also just highlight to the community, it's critical that people do not just focus on the risk accruing in the Avalon or any areas of the Northern Beaches. At this point in time, we don't know how the spread occurred. So there is some missing people in there. And those missing people, we don't know whether it's one missing person, two missing people. So that could have set up other chains of transmission. Now, this requires us to have higher testing rates across the state of New South Wales, because you can see how explosive this can be. We tell you one day that there are a couple of cases, and by the time we had the great turnout from the community and we've tested a whole lot, we're now at a total of 28, okay? If that had have not been detected, you can imagine a few days later, we would have been announcing very high numbers. So the thing I would urge the community across the state is come out for testing, but also recognise the high-risk sort of activities. Singing, chanting, shouting, going into noisy environments, indoor environments. These are risky environments. But the critical element is get tested, and please do not go out and about if you've got any symptoms whatsoever.
Last question, please.
Dr. Chan, you've stared down the virus, the outbreak and clusters quite often over the past few months. You've got 28 cases in 36 hours. How serious do you rate this one to the other outbreaks that you've defeated?
I think the retrospectoscope is always useful in giving the best answer to that, but clearly my anxiety is that we haven't found the direct transmission route and can't be ensured that we've blocked every transmission line. And so that's why we need both the response in the Avalon Northern Beaches area, and I've just got to thank the community. Those queues are actually warming my heart. But we just need to also get the message out that everyone across the state at this point of time, we just need you to be taking this matter very seriously, presenting for testing anywhere, but also making sure that you don't go out and about if you're sick, that you're staying home, that you're thinking about the risk environments and taking appropriate action, such as wearing masks when you can't socially distance.
Could we just clarify, Dr. Chan, briefly? You're relying on people's goodwill here to follow what you're asking them to do. Do you believe there's a need for a health order here to make people do this?
So as the Premier said, the government will be monitoring this situation very, very closely. And if we do not, and I think the Premier indicated in her introduction, I'll let her speak, but
I often speak for you, so you
that we will be open to all options. I think that's I think I've
going early.
That's correct, and that's why we went out at 6:30 last night. You know, the cases came to us, but I am urging the community that the more intelligence we can have about what we're dealing with will allow us to calibrate our response. But clearly, we know the sorts of venues that represent greater risk. Indoor venues, hospitality, places of worship, gyms are high-risk venues for us.
Should those venues and other areas of Greater Sydney be checking IDs this weekend and turning away anyone who is from Avalon or the Northern Beaches?
Certainly, I would be encouraging people to take it seriously, that people should be alert to first the check-in apps. Just to let you know, everyone that's been at those venues over the next 3 days, we will have got to everyone through the contact tracing. But we're also noting some deficits in some of the record keeping at some of the venues. And so there will always be gaps. So again, urging the community, if you've known you've been at those venues, you may not have checked in, but please also adhere to the health advice.
From the other hand, you would encourage them in Greater Sydney, you would encourage them to turn away people.
So for instance, we, in relation to the club at Penrith, we are asking them to specifically, for every new entrant to that club, checking that they are not on the contact list that were exposed at that venue. So we certainly would be asking that clubs are cautious and do all they can to make sure that people that are on those contact lists do not attend.
Thank you, everybody.
There's this grey area about what's essential. Some people think Christmas shopping is essential. Would you consider moving to the 4 or 5 essential reasons you had, at least as advice, that being shopping, medical supplies, work, as advice for Northern Beaches residents?
I think that there's common sense prevails, and we have many more days till Christmas than the next 3. We're actually really just encouraging people to stay home, and I think our message last night was actually very clear. Please stay at home at the moment.
Thanks, everybody.
Thanks, everybody.
Thank you all.